Time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. As always, it is great to have you in studio with us today. We are sitting down with Yavapai County Community Health Service Director Leslie Horton. Welcome back to studio, Leslie. Well, you're not in studio, but you're here with me virtually, so that's great.
Yes, well, thank you for allowing me to attend virtually. It's challenging in my mornings now with school back to session 2 days a week and trying to be too many places at once. So thank you for having me.
Thanks for pushing things around. I know you had to move things around in order to be with us here today, so I appreciate you moving things in your schedule so that you could bring us up to speed on this. I think it's been a couple of months now since I've actually had you or Stephen Everett on to talk about this, and I thought, well, now's the time. We're we're hoping to transition out of the hot weather into the cool weather. That really hasn't happened just yet, although it's fall, but it's coming. And I think that's where I want to start first. Back when summer was about to be here and it was still spring, people were like, oh, when COVID-19 hits the summer heat of Arizona, there is no way it's going to survive. It's going to die. It's not going to be able to stick anywhere. We're going to be okay. COVID's going to go away. And we talked about then that that's not the case because it was worldwide and some places were hot and some weren't. Well, we had an extremely hot summer, a very hot summer this year, one of the hottest ever, and COVID stuck around just fine. And I'm wondering if people are thinking maybe now that winter's coming, that maybe the cold is what will kill COVID-19. So what's the latest on COVID-19? And he seems pretty healthy and he's doing just fine with no matter what we throw at him.
Yeah, I've been very thankful to see a reduction in cases recently, but I think it's more the mitigation strategies that we've put into place versus the actual weather. And this one just does not seem to be heat resistant. It does not seem to be affected even by cold weather. When we first saw some increases across the nation, it was in some pretty chilly areas, places like New York and places that were not hot yet. And so our weather, I don't know if it'll ever get cold enough to really test a cold temperature here in Arizona, if it has any effect. But I'm very thankful to see that the cases are lower. And one thing we do see is that it does not pass very well outdoors. Most of the spread that we see is from indoor spaces. If you're really close to someone really outdoors, you might catch it from them if they're coughing, sneezing, or otherwise sick with it. But really where we see the spread of COVID is indoors, where it's climate controlled and easily passed along. And yeah, we're not seeing a whole lot of impact due to weather.
It's interesting, I see people driving down the road in their cars with their windows up, and you'll see some people wearing their masks while they're by themselves in their car driving down the road. We went for a hike around some lagoons and stuff this last weekend, and my wife and I weren't wearing masks, but I noticed some were and some weren't out there hiking in the great outdoors. And we had talked about this, that being outside with the airflow and the movement and everything, it's much safer to be outside than to be inside. And I think that's why we've seen such an increase in camper sales and everything else. Everyone's in the great outdoors this summer to avoid just being indoors and close to each other. So there's that. Now, COVID is a coronavirus, and that means coronaviruses are able to morph and change as they see fit and whenever they feel like doing it. Are we seeing any changes in COVID-19 from when we first had the pandemic kind of noticed in March to this point? Do we see it weakening? Do we see it getting stronger? What's the latest on that?
Some people feel as though it's weakening. I think we're getting better at combating it and reducing the spread, and possibly better at protecting our most vulnerable. So we are seeing a significant decrease in hospitalizations, and the hospitals are getting better at treating this. And it seems like people are in the hospital a less amount of time. They used to be in the hospital for weeks, and some people still can be, and it can be still very deadly for someone who is of advanced age with a compromised immune system. But I have not seen that it's necessarily weakening. I think who is getting sick has changed, in that now our college student demographic and our youngsters are getting infected at a higher rate across the nation now that colleges are back in session, schools are back in session, and those individuals simply don't get very sick with COVID-19. And it's different than other coronaviruses in that sense, in that it is affecting different age groups very differently, and especially if you have anything compromising your immune system, it can still be very harsh. So I haven't seen necessarily a dramatic decrease in its effect on people, but maybe the demographic of people getting sick has changed a little bit.
So this one's pretty unique then. It's pretty... I guess maybe I'm thinking this wrong. It's not a selective virus. It'll go into anybody at any time. We've talked about that before, way back in spring, that this coronavirus isn't just picking the elderly or picking the young people, or it's everybody. It just happens to impact the elderly and people with underlying health concerns the most. At least that's how it appears.
Yeah, it does. And, it's not selective. However, they are finding different things can be preventative and protective for your body. Things like having a really good, strong immune system, possibly vitamin D from the sun or from supplements can help to be protective against this. And then, being of a younger age and those things that we know are protective. But it's not necessarily selective in who gets it, but we are finding like small children under the age of 10 have a lot less likelihood of spreading it. And so it's different in that way too. It's a strange virus, because usually those are our little spreaders, or our young kiddos, and they're, tend to be less careful with, possibly sneezing, coughing, picking the nose, those kind of things that might spread germs to others. Yet they're less likely to catch it. And one other thing that they're seeing some studies on is that type O blood can be a little bit protective in a way too. So people with type O are getting COVID, but they are better suited to fight it off. So there's some interesting new information about COVID that we're learning all the time. None of it has given us a cure or any way to truly stop it, but we are finding out more about what is protective against it.
That seems really unusual. Stephen Everett's probably kind of rolling, that's the county's epidemiologist, but Stephen Everett's probably pretty interested in this COVID-19 to see what it's doing and how it's reacting, because what you're saying there is really unusual. Now, what about, you mentioned treatment. People seem to be spending, and I want to say it's not all people. I mean, there's those folks that it's just devastating for them. But you're saying some people now, it seems like they're less time in the hospital, better treatment from the hospitals. Exactly what's being done that has improved since, say, spring, early summer when we saw you last?
They're waiting longer to put people on respirators and to intubate people, which is helpful. They found that doing that too soon might be harmful with this, because it can maybe exacerbate or be more conducive to the infection that can happen in the lungs, those kind of things. But also we have drugs like remdesivir, which was in a trial period a couple of months ago. We were giving it to the hospitals for free to try it on patients, because there really wasn't any other great method of treating this at that point. There was the hydroxychloroquine and some of those other trials also, but the remdesivir is somewhat like Tamiflu with the flu. Tamiflu will cut down the duration and the severity of symptoms if you get the flu and if you take it early. Remdesivir for COVID-19 is very similar. If someone's in the hospital, it is very expensive now, so but it's well worth it. If someone's in the hospital and not in advanced infection or otherwise advanced illness, they can take remdesivir and it'll cut down the duration and the severity of those symptoms in most people.
Well, safe to say we'll come back. We got to take our first break, okay? Yavapai County Health Department Director Leslie Horton in studio today. The website is yavapai.us. You can go there and get the COVID numbers for Yavapai County each and every day, just a little after 10 a.m. Stick around. Countywide back in just a couple minutes.
Terrifying job. Snake handler, take one. James, this is a really terrifying job. Given the hazards, why do you do it?
I've been fascinated by reptiles since I was a child.
Tell me about your little friend there.
So this is Bear Hug. He's a Burmese python. We have him here at the Phoenix Zoo.
It kind of makes my skin crawl. Is there anything that rattles you?
Yeah, distracted drivers terrify me.
Two things we can count on every year.
A new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
With too many senior homeowners falling short in their retirement dreams, there may be great news for you. A reverse mortgage may be the answer. The flexibility it provides may help you with your retirement dreams, peace of mind, and quality of life in your retirement. For your in-home, no-obligation consultation, contact me at 928-225-7418. That's 928-225-7418. Or you can find me at Facebook at Jim Hostler, Reverse Mortgage Specialist.
Hi, this is Lori and Melissa from Sedona Soul Spaces. We are the premier source for all your interior design, decorating, and staging needs.
Every day people ask, why didn't I call you sooner?
Let us use our passion, creativity, and experience to make your life easier.
Don't make costly mistakes. Call us and we will help save you time and money.
We offer full-service interior design, custom furnishings,
complete home staging, turnkey vacation home packages.
Sedona Soul Spaces, creating extraordinary spaces that delight your soul.
Welcome back to Countywide. I'm Paul David, Yavapai County Health Department Director Leslie Horton in studio today. Yavapai.us is the website you go to for information about COVID-19 or anything related to Yavapai County. Leslie, we talked about a drug there that seems to be helping some patients that go in with COVID-19, and you mentioned earlier that there is no cure yet. We're obviously still working on a cure. Have you heard anything about how that's coming along and a vaccine and when it'll be available to the public?
Yeah, we have heard a lot about a vaccine. I have not heard a lot about a cure. I know that there's a lot of labs working on something, working on different opportunities for a cure and looking at what's working and what's not. I haven't heard recently as to if there's anything promising. The vaccine, though, is in its phase 3 trials with several different vaccine companies. And so what we're doing as a health department is preparing for that. We're looking at refrigeration needs because we'll have to store the vaccine. Many of the vaccines in trial right now are a 2-dose vaccine. And then we would also, many of them are requiring an ultra cold storage, which makes it a little complicated for us, except it sounds like we can get regular refrigerator freezers. And it'll be storable for a certain amount of time in the packaging it comes in until we can distribute it. And that is still to be seen, though, as to when it's going to actually be approved and ready to administer. The phase 3 trials are in process, and the companies are making sure that they're not cutting corners. They've had to kind of race this one into market, and we want to make sure that they don't cut corners and actually make sure that all of the bugs are worked out and any sort of side effects are noticed prior to us administering it to the masses. And also when we look at that vaccine, it's going to have to be prioritized. This is something that's going to be used nationwide, if not worldwide. And there's going to be limited supplies at first. So what we're looking at too is that prioritization of who's most at risk and most vulnerable to COVID-19, and how do we get it out to them first.
And then the people that we need on every day, like the first responders, police, fire, and all that would be pretty important too. I would imagine those folks are going to be some of the first to get that. Let me ask you this question. Back in the summer, back when this first started, it was kind of thought that if I were to pick up COVID-19 and survive it, and I've got the antibodies in my system, that maybe I'm immune to getting it again. And I hear different things where one person said, well, they were diagnosed 2 months ago with it. They were, then they were clear, and now they're positive again for it. Do we have a better idea as to just how defended am I? If I get it, am I set? Am I not going to get it again, or could I get it again?
It is not clear yet, really. And what we're seeing, even on a local level, there's a lot of studies going on with this. So someone who is diagnosed positive with COVID, then clears it, is recovered. They're doing antibody testing on those individuals to see if they maintain antibodies. Pretty much all of those people are going to test positive afterwards for antibodies, but the duration of time is varying in individuals as to how long those antibodies stick around. And so we've even had some local individuals who tested positive, and within about 4 months after they were testing positive for antibodies as well, are testing negative for antibodies. And that's not everybody, but there are a few individuals, and there have been across the globe a few instances of people getting COVID-19 twice already. But I think it's going to be a rarity, and I do hope that for the most part, people will maintain some sort of immunity, which comes from having those antibodies from fighting off COVID originally. And so that's still to be seen, though. And we're 6 months into the pandemic. It really didn't strike here until July in a more substantial way. So we're still, even on a local level, trying to see if people are maintaining antibodies. And it'll also be interesting as to how long the vaccine is good for, if people are able to clear the antibodies quicker. So we're hoping we can come up with some sort of lasting result so people don't have to continuously be vaccinated, or that if they've had it, they can actually feel good about the fact that they may be immune to it for a while.
I think it's important to point out that this is brand new. In 6 months, it's amazing what's been done so far in 6 months for something, a virus that's brand new that we've never seen before and know anything about. And here it is. We've got all these vaccinations being made, and people have been working so hard on it for the last 6 months to try to get ahead of this thing. Are we seeing an uptick? So I guess what I was saying is that we're learning stuff new about COVID-19 every single day, and with the fact it's a coronavirus and it can change as it wants to, what we know today can be different, very different tomorrow, or a week down the road, a month down the road. You mentioned earlier in the show that we are seeing kind of an influx in the younger people getting it, because we are back in school now. College is back in session. I think Coconino County's seen a bit of an uptick with the college, and the governor, Doug Ducey, last week mentioned $14 million is going to be going to the universities to help them try to contain the spread within the colleges. Are we seeing a lot of problems with the kids taking it to school, giving it to the kids, and then the kids take it home and maybe mom and dad didn't have it, or grandma and grandpa maybe are living there too, aunts and uncles? Are we seeing any of that happening?
So far in our K through 12 schools, those ones that have gone back to session, we have had very few issues at all. And most of the time, if kids have had to go home sick, they get tested, and for the most part, most of those kids have been negative. Now, I think we had a little handful of kids in the same family or household that had COVID, but it was able to be isolated just to those kids. They stayed home, did their quarantine period and isolation, and they're back to school. And so we've been very fortunate with K through 12 schools. Most are either in a blended or hybrid model of learning. Many of our K-12 schools are going back into traditional education after fall break, which is here in a couple of weeks. So later in October, we're going to be watching closely, and we're here to support those schools if they do have cases, and we walk them through exactly what needs to do and what they need to do, how to notify parents, how to let people know if they've had an exposure. Now with colleges, we are seeing an increase in those universities. In U of A had an outbreak that's still, I think, ongoing, and Coconino has had an increase through NAU. They both have COVID quarantine dorms set up so that if someone does test positive, they can go quarantine there. We are encouraging families not to bring their students home if possible, because if they have younger kids or themselves in the household, it could have an impact on our cases here in Yavapai County. But so far, our colleges here locally have not had a major instance of outbreak. There have been some cases pop up, but thankfully it hasn't been widespread in any manner.
All right. Let's take our second break. Yavapai County Community Health Service Director Leslie Horton in studio with us today. Yavapai.us is the website. Stick around, Countywide back in just a couple minutes.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle. Get Gettles.
Hi, this is Greg at Verde Solar Power. You know, Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Orkin has pest control down to a science.
When your business chooses Orkin's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the Orkin man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona Orkin and get more than an exterminator. Get an expert.
Welcome back to Countywide. We've got just a few minutes left in the program with Yavapai County Community Health Service Director Leslie Horton. We're talking about COVID-19. I want to switch a little bit. Flu season is coming up for us, if it's not already here already. Are we expecting some compounded things happening with COVID and the flu now? You know, where are we at with that? What do we think?
You know, there's some possibilities of difficulty during our flu season. One bit of good news is that the Southern Hemisphere is generally ahead of us in flu season, and they had a very, very light flu season down in Australia. And so we're hoping that our flu season will mimic that in some ways, and that, you know, all of these mitigation strategies that we have in place, mask wearing indoors, lots of sanitation, hand washing, remembering not to cough and sneeze on others, staying home if you're sick, all of those things should be very protective against flu as well. And with the flu, we do have the vaccine. And so that is a good thing too, in that if people get the flu vaccine, if they have exposure, it should extremely reduce their symptoms of the flu, if not completely stop it from giving them any trouble whatsoever. And so we're hoping that a lot of people will get their flu shot this year. We're doing free rural flu shot clinics. People can go to our website to find out when and where those are to get a flu shot, or many grocery stores and pharmacies offer them. We do encourage people to get that flu shot simply because this year we already have enough difficulty with COVID and identifying symptoms and making sure people are staying well. We want people to bolster their immune systems and be prepared for whatever this fall and winter have to bring. And getting that flu shot just cuts down the chances of coming down with a severe flu illness as well.
All right, we're out of time. We got about 30 seconds left. So again, thank you for moving things around in your schedule today and such a last-minute effort to be here with me, to be able to give us an update on COVID-19 and touch on the flu season just a little bit. We're running a story about the flu vaccination clinics that the county is doing, so we do have that. But yeah, thank you for doing this, and I guess we'll probably talk to you again in a couple more months here as winter sets in and see how things are going for Yavapai County. That's the show. Yavapai County Community Health Service Director Leslie Horton. Again, thank you very much. Yavapai.us is the website. Thank you so much for watching and listening. That's today's Countywide, and we'll talk to you again next time.